د رسنیو محترمو استازو او مېلمنو ته السلام علیکم ورحمت الله وبرکاتو. دا غونډه د حادي خوارځواکۍ د درملنې د ملي لارښود چې د ایمم یا د حادي خوارځواکۍ په نوم د پیژندل کېږي د بیا نوي کولو بهیر د پرانیستي لپاره رابلل شوې ده. لکه څنګه چې تاسو ته معلومه ده ایمم لارښود وروستی ځل په 2013 میلادي کال کې نوی شوی و. له هغې وروسته د تغذیې په برخه کې نړیوال معیارونه د روغتیا نړیوال سازمان سپارښتنه او د شواهدو پر بنسټ عملي تجربو د پام وړ بدلونونه موندلي دي. همدارنګه زموږ د هیواد واقعي وضعیت، بشري ننګونو او د حادي خوارځواکۍ د پیښو د بڼه هم بدله شوې ده چې دا ټول د دې اړتیا څرګندوي چې موږ ملي لارښود باید له نړیوالو معیارونو سره همغږی، علمي او عملي پاتې شي. د ایمم د نوي کېدو لارښود په دې بهیر کې د حادي خوارځواکۍ د تشخیص او د درملنې میکانیزمونه، د اوزیما یا پړسوب اړونده تخنیکي تعریفونه، د داخل بستر او د ټولنې پر بنسټ د درملنې لارې، همدارنګه د پلي کېدو یا عملیاتي پلان اړوند مهمې برخې بیا کتل شوي او معیاري شوي دي. سربیره پر دې د درملنې اړوند ځینې پروتوکولونه د روغتیا نړیوال سازمان وروستیو سپارښتنو او د نړیوالو غوره تجربو پر بنسټ نوي شوي دي. زموږ اساسي موخه دا ده چې یو داسې ملي لارښود ولرو چې علمي، په شواهدو ولاړ او د نړیوالو معیارونو سره برابر وي، د هیواد له واقعي شرایطو سره عملي تطبیق ولري، د روغتیایي کارکوونکو لپاره روښانه، ساده او د پلي کېدو وړ وي، او په پایله کې د ماشومانو، میندو او زیانمنو قشرونو د ژوند د ژغورلو، روغتیا د ښه والي لامل شي. د دې لارښود د نوي کولو کابه 9 میاشتې وخت ونیو چې د دې بهیر کې تقریبا 44 تخنیکي د موږ ماهرین دي او په دې کې 3 خارجي کنسلټانټ ولو چې 15 سب کمیټې د دې لپاره وي، 15 فرعي کمیټې وي او یو مشورتي یا رهبري کمیټه وه. د درملنې او مدیریت پروګرامونه معیاري کول د مړینې او ناروغیو کچه په راکمه، دغه لارښود به د مړینې او ناروغیو کچه راکمه کړي او د روغتیا خدمتونو د وړاندې کولو تسلسل او عدالت به برقرار وکړي. نو زه غواړم چې د عامه تغذیې ریاست په استازیتوب د ټولو تخنیکي او کارپوهانو، شریکي بنسټونو، د روغتیا نړیوال سازمان، یونیسف او نور همکارو ادارو څخه مننه وکړم چې د دې مهم ملي بهیر په مالي ملاتړ او تخنیکي همکاري زموږ سره همیشه ترڅنګ ولاړ. په پای کې هیله لرم چې د نوموړي لارښود به د خوارځواکه ماشومانو د درملنې او مدیریت ټول اړتیاوو ته ځواب ویونکی وي. او همدارنګه ستاسو څخه هیله لرو چې د نوموړي لارښود په پلي کولو کې نه ستړي کېدونکي هلې ځلې له موږ سره وکړي. یو په تغذیه کې چې ډېر زیات موږ ته انرژي رابخي، هغه دغه د موږ داخلي ایکسپرټ کسان دي. الحمدلله موږ په داخل د هیواد کې تغذیه ښه ماهرینو، متخصصین او تکړه کسان لرو چې په ملي سطح باندې ځلیدلي دي او د هیواد نه بهر هم د نومونه لري. نو همدغه لامل دی چې موږ په تغذیه کې په ښه مخکې روان یو. په اخر کې before concluding I would like to sincerely thank all partners, stakeholders for their available technical coordination. We particularly appreciate UNICEF, WHO and WP for their continuous technical, financial and strategic supports to strengthening national nutrition system and aligning our work with international standards. As we move forward with the finalization and implementation of the revised IMAM guideline, we look forward to continuous collaboration, including support for the PND staff's capacity and for the National Nutrition Survey, which is really needed. We need it.
په پیل کې د عامې روغتیا وزارت په استازیتوب تاسو ټولو درنو ګډونوالو ته د زړه له کومې هرکلی وایم او ویاړم چې د هیواد په کچه د حادي خوارځواکۍ د مخنیوي او مدیریت د ملي لارښود او تطبیقي پلان د پرانیست غونډه کې ستاسو ترمنځ حضور لرم او قربا یم.
At the beginning, again, I welcome you all in this very important meeting, and I'm very happy that we are participating in the launching in a program of integrated acute malnutrition management, and also the launching of a national guideline on acute management of integrated management of acute malnutrition. And I am very happy that I am among the team, and I am happy that the Ministry of Public Health is hosting this very important meeting.
درنو حاضرینو، روغتیا د هرې ټولنې بنسټ جوړوي او سالم انسان د یو ځواکمن ملت د جوړېدو اساسي ستنه ده. هغه ټولنه چې ماشومان یې له خوارځواکۍ سره مخ وي د ودې ثبات او پرمختګ په لاره کې له جدي ګواښونو سره مخ کیږي.
Dear colleagues and gentlemen, the health is the foundation of each community, and healthy people are the basis for a healthy nation. And in a community where there is malnutrition, and people are facing with malnutrition, they face many challenges in connection with development and improvement in the country.
حدا خوارځواکي یوازې د وزن یا قد ستونزه نه ده، بلکې د ماشوم د ذهني ودې، معافیتي ځواک، د زده کړې راتلونکي وړتیا او حتی د ژوند د دوام لپاره یو خاموش خو خطرناک ګواښ دی.
Acute malnutrition is not only measurement of weight and height, but it is also affecting the growth and development and mental development of children, and also the immunity of children. These children that they are suffering from malnutrition, indeed there is a very silent tsunami that can be defined in the country when there is more malnutrition among the children.
دا ستونزه د یوې کورنۍ له کړاو څخه پیلېږي، خو اغېز یې پر ټول ملت پرېوځي. د عامې روغتیا وزارت د هېواد د روغتیایي نظام د رهبرۍ په توګه تل هڅه کړې چې د ولس روغتیا ته یو سپېڅلی امانت په سترګه وګوري.
Though malnutrition is beginning at the household level, but the effect is on overall national level. The Ministry of Public Health leadership is willing to see that children health and health of the people is a spirituality mission, and we want to move for that spirituality.
د روغتیایي چوپړتیاوو پراختیا، د لومړنیو روغتیایي خدمتونو پیاوړتیا، د میندو او ماشومانو روغتیا ته ځانګړې پاملرنه او د زیانمنونکو قشرونو ملاتړ تل د وزارت د اساسي لومړیتوبونو برخه پاتې شوې ده.
Provision and expansion of health services, focusing on primary health care needs, focusing on mother and children's specific health needs, and focusing on the vulnerable population are the priorities of the Ministry of Public Health.
نن چې موږ د حدې خوارځواکۍ د مخنیوي او مدیریت د ملي لارښود او تطبیقي پلان د پلي کېدو شاهدان یو، دا د همدې دوامدارو علمي هڅو یو مهم ثمر دی.
Today, as we came together to launch the plan for integrated management of acute malnutrition, indeed, these are the basis for a good future, and also these are the basis for technical, professional movement and development in the country.
دا لارښود د نړیوالو معیارونو، د نړیوالو روغتیایي بنسټونو د سپارښتنو او د هېواد د واقعي اړتیاوو یو بنسټ ترتیب شوی ترڅو د خوارځواکۍ وقایه پر وخت تشخیص معیاري درملنه او دوامداره تعقیب په یو منظم سیستم کې تنظیم کړي.
This guideline is developed on the basis of international norms, on the basis of international fundamental recommendation, and also on the basis of country need. This guideline will help to prevent in-time diagnosis, appropriate and professional treatment, and also looking for continuous professional development in the health system in Afghanistan.
د عامې روغتیا وزارت ژمن دی چې دا لارښود یوازې د مرکز تر کچې محدود پاتې نشي بلکې په عملي بڼه د هېواد تر ټولو لرې پرتو سیمو پورې ورسیږي. زموږ موخه دا ده چې هر روغتیایي مرکز، هر روغتیایي کارکوونکی او هره ټولنه د خوارځواکۍ د مخنیوي او مدیریت په برخه کې روښانه لار ولري.
Indeed, this guideline should not remain in the Ministry of Public Health in the center here. We want to see that this guideline reach to far remote area and also to be reached to those areas where there is implementation need for this guideline. And also we need to see that this is reached also to very remote villages. We are aiming to support health workers, and we are aiming to support the communities, and also we are aiming to support the families for prevention and also their participation in the management of acute malnutrition in the country.
د روغتیایي کارکوونکو ظرفیت لوړول، د خدماتو کیفیت ښه کول، د ټولنې پوهاوی زیاتول او روغتیا خدماتو ته د ماشومانو او میندو پر وخت لاسرسی زموږ د عملي تګلارې اساسي برخې دي.
Training of health workers, improving the quality of services, improving community awareness and participation, improving services for children and mothers, improving access for on-time support to mothers and children are practical principles of our strategic action in the country.
موږ په دې باور یو چې د خوارځواکۍ پر وړاندې مبارزه یوازې د روغتیا سکتور مسؤلیت نه دی، دا یو سکتوري موضوع ده چې د تعلیم، اقتصاد، ټولنیزو ارزښتونو، دینی لارښوونو او کورني پوهاوي له کچې سره مستقیم تړاو لري.
We believe that management of acute malnutrition is not a responsibility of one organization. It is a principle that we need to follow for a multi-sectoral approach to address this issue. We need to see the participation of education team, economy team, agricultural, population, and also we need to see that the religious leaders participate effectively in this program for good results.
له همدا امله د عامې روغتیا وزارت تل ټینګار کړی چې علماء کرام، قومي مشران، ښوونکي، رسنۍ او کورنۍ باید د دې مبارزې فعاله برخه واوسي. کله چې یوه مور د سالم تغذیې ارزښت درک کړي او یو پلار د خپل ماشوم د روغتیا ساتنه خپل لومړیتوب وګرځوي، هماغه ځای د بدلون پیل دی.
The Ministry of Public Health always emphasizes on the role of religious leaders, on the role of community elders, on the role of the teachers, and also on the role of media and families to actively participate in this process of management of acute malnutrition and services. When a mother is benefiting from good nutrition, And also when a mother knows about the value of good nutrition, when a father knows how to manage their children in connection with malnutrition prevention, these are the priorities that we need to focus. And also these are the basis for changes at the household level.
قدرمنو ګډونوالو، موږ د روغتیا په برخه کې د ملي او نړیوالو همکارانو له دوامدار ملاتړ څخه مننه کوو. ستاسو تخنیکی، مسلکي او بشري همکارۍ دا زمینه برابر کړې چې د خوارځواکۍ په برخه کې له بیړنیو مرستو څخه د دوامدارو حل لارو پر لور ګام واخلو.
Dear colleagues, dear participants, and dear member of support community with the Ministry of Public Health, we are always appreciating your support, and also we are appreciating your continuous support in all the health sector development. Your technical, professional, humanitarian support prepare the ground for better implementation of services and prepare the ground that we move from emergency to more sustainability program in the country.
په پای کې غواړم تایید وکړم چې تر هغې چې زموږ یو مشون هم له خوارځواکۍ سره مخ وي، زموږ هڅې باید دوام ولري.
Again, I want to emphasize at the end that even when one child is suffering from malnutrition, we should not rest and we should continue our effort to meet those needs.
دا ملي لارښود او تطبیقي پلان د یو نوي پړاو پیل دی، د داسې پړاو چې پکې د ژوند ژغورنه، انساني کرامت او د راتلونکي نسل ځواکمنتیا زموږ ګډ هدف دی. راځئ چې په ګډه په اخلاص، مسلکیتوب او ملي احساس سره دا پلان عملي کړو تر څو افغانستان د سالمو ماشومانو، روغو میندو او یوه پیاوړې ټولنې په لور خپل حرکت ته دوام ورکړي. مننه. والسلام علیکم ورحمة الله وبرکاته.
In so doing, to also acknowledge the presence and the support of my colleague, Dr. Edwin Salvador, the WHO representative in Afghanistan, as well as the deputy representative for WFP, Ms. Mutinta Chimuka, who has also brought all the support from WFP to this very important work. I want to thank all the directors in the Ministry of Public Health for their continuous engagement with UNICEF, but more importantly for the children of Afghanistan. Today, let me single out the Director of Public Nutrition Directorate for his leadership that led to the finalization of the documents that we'll be launching here today. I'm happy to have my colleagues from the UN, from the academia, but also from the media here with us. Bismillahir Rahmanir Rahim. It is indeed a great honor for me and for UNICEF to join today the launch of the revised guideline on the prevention and treatment of wasting in Afghanistan. This moment marks an important but also a very great milestone in our collective effort to address acute malnutrition and safeguard the lives and future of our children in Afghanistan. On behalf of UNICEF, I would like to commend the Ministry of Public Health, particularly the Public Nutrition Directorate, for their strong leadership, cooperation, and commitment to evidence-based action and planning to advance critical milestones in Afghanistan. Allow me to also recognize the IMAM steering group from the United Nations and partners that work closely with the Ministry of Public Health for their tireless work in the past 12 months that led to the development of this document. UNICEF greatly appreciates the cooperation, the partnership, but more importantly, this significant result that we have in front of us today. Unfortunately, in Afghanistan, we continue to be faced with huge number of children who are severely acute malnourished. And that crisis continues to spread, driven in part by what we call child food poverty, but also by the economic collapse, the drought, but also the exposure and vulnerability of children to illnesses and limited access to safe drinking water. These situations, together with natural disasters, have increased the vulnerability of our children to malnutrition. In 2025, we had estimated that 3.5 million children in Afghanistan will be malnourished. Unfortunately, in 2026, the estimate has increased to 3.7 million children. And this is inclusive of about 1.3 million children who are faced with life-threatening severe wasting. Beyond wasting, the implication for malnutrition, especially wasting, is grave for our children. Wasting increases the risk for death in children by about 12 folds, and severe wasting in the first 1,000 days can also reduce the ability of children to attain full developmental cognitive potential between the ages of 5 and 11. What I'm saying is that their IQ will be affected and it will be low. And this will impact the ability to learn in school, to develop, and eventually to contribute to the economy of the country. What we know globally is that when a population is impacted by malnutrition, the impact of that on the economy is estimated to around 2 to 3% reduction in the annual gross development product GDP of the country. And this is not good for us in Afghanistan, as the economy is just picking up. Guided by the 2023 WHO Global Guidance on the prevention and management of wasting, and grounded in many years of hard-won experience in Afghanistan, and it is important for us to acknowledge the academia, the implementers, as well as the Ministry of Public Health, who have been on the ground for so many years understanding the context in Afghanistan. And all that knowledge together led to the revision of the national guideline that is being introduced today. What is different about this guideline? Allow me to share 4 top lines of what is new in this guideline. The first is that this guideline will ensure that program implementation when it comes to treatment of wasting becomes more effective, and that we prioritize areas where there is specific need for children. In so doing, specially formulated food will be reserved for children that are faced with the most life-threatening forms of malnutrition. The second is that this guideline places a strong emphasis on home-based diet, empowering our mothers, our fathers, and our communities to use food items at home to feed children and drive multi-sectoral prevention, which was highlighted by His Excellency, the Deputy Minister, in his speech. In so doing, we hope to reduce over-reliance on feeding program and push for a more cost-effective nutrition program in the long run. Thirdly, this guideline reinforces the central role of community health workers as the frontline workers for both the prevention and the treatment of wasting. And lastly, for the first time in Afghanistan, this guideline provides a clear, standardized guidance for the prevention and management of wasting amongst infants under the age of 6 months, who account for nearly 30% of all admissions to therapeutic feeding units in the country. This is why the release of this guideline today is gladdening and heartwarming, because this guideline, together with the joint action plan to stop child wasting and rationalize the strategy and implementation plan in the country is extremely significant. Together, these two documents provide a coherent national framework that enables two broad objectives. The first is that it will ensure that the most life-threatening form of wasting is addressed in the country, and that secondly, it will help us to tackle the underlying drivers of malnutrition for children in Afghanistan. Allow me to thank all the technical team from the Ministry of Public Health, from the WHO, from WFP, and from UNICEF for working together to give to us this very important document. On behalf of UNICEF, I want to reassure that our commitment to ensure availability of ready-to-use therapeutic food to support treatment of malnutrition will continue, and we are grateful to all our donors who have stood by us to ensure that the pipeline for this is in place. We will also continue to support the 3,400 health facilities across the 34 provinces where we deliver nutrition services in close coordination with the Ministry of Public Health and under direct partnership with WHO and WFP and our implementation partners. I am pleased to share that in 2025, UNICEF support led to the treatment of more than 600,000 children with severe wasting in Afghanistan. And in 2026, we expect that this number will increase, and together with WFP and WHO, we hope to be able to respond to this huge number, even in the face of reducing funding to the country. At the same time, allow me to also state that we are not only about treatment, we are also about prevention. And this is why in 2025, UNICEF, together with WFP and FAO, launched the first food initiatives, a multi-sectoral, multi-agency strategy that seeks to promote and support home-based diet for our children as a way to reduce the number of children who will become malnourished in the country. We are very confident that this new strategy will not only empower households and mothers, but to ensure that the limited resources in Afghanistan for treatment of children will be directed to the most in need. I would like to use this opportunity once more to thank and commend the Ministry of Public Health for their leadership, WHO for their technical guidance, WFP for their operational lead, and UNICEF team for keeping true to the cause for children. Let me also acknowledge the wonderful work of our implementing partners out there, as well as the frontline community health workers who are there every day with mothers, with children, fathers, and communities to ensure that our children are identified on time and treated on time so that they remain safe. As I conclude my speech, Your Excellency and my colleagues, today's launch is not just about introducing a guideline. It is a major shift in our approach, and it is my expectation that making available this guideline and support to the frontline workers in the communities, in the facilities, will bring long-term change for our children. In the face of all the limitations, please be assured that UNICEF stands committed to supporting Afghanistan to protect all our children from malnutrition in the years to come. I thank you very much. Assalamu alaikum.
The presence of the Deputy Minister of Public Health for gracing this very important event, as it demonstrates the strong leadership and commitment of the Minister of Public Health in addressing malnutrition in the country. It is a pleasure to join you today for the official launch of the Afghanistan National Guideline on the Prevention and Management of Wasting. This important milestone reflects our shared commitment to improving child survival and strengthening nutrition services across the country. Wasting remains a major public health challenge in Afghanistan, and as Dr. Tajuddin Averi said, driven by multi-factors, including food security, recurrent emergencies, and limited access to essential health and nutrition services across Afghanistan. In this context, Having an updated, evidence-based, and nationally adapted guideline supported by a clear implementation roadmap is essential to improve the quality, coverage, and effectiveness of care. The adaptation of the global WHO wasting guideline was not only timely but necessary. Afghanistan faces unique operational realities, including humanitarian settings, limited health workforce capacity, access constraints, supply chain challenges, and high disease burden. A global guideline alone cannot fully address these contextual factors. Therefore, this national adaptation ensures that recommendations are practical, feasible, and aligned with the country's health system capacity, service delivery platforms, and emergency response mechanisms in place. This achievement is the result of strong collaboration and leadership by the Ministry of Public Health with support from the World Health Organization, United Nations Children's Fund, the World Food Programme, and other UN agencies, implementing partners, and national experts. Together, we have adapted the 2023 WHO Global Wasting Guideline to Afghanistan's operational realities while maintaining the highest technical standards required. Today's launch marks the beginning of the implementation. The real impact will come from translating this guideline into action at the facility and community levels, strengthening service delivery, improving referral systems, and building the capacity of the frontline health workers. Through this, we can move closer to achieving the national and global nutrition targets that we've all agreed upon. I would like to congratulate the Ministry of Public Health for its leadership and strong ownership of this multi-sectorial process, and sincerely thank all the donors, partners, technical teams for their dedication and valuable contributions to this process. Similar to the sister agencies like UNICEF and WFP and other implementing parties, WHO reaffirms our commitment to supporting and achieving the best health and nutrition for the Afghan population. I would also like to thank the media colleagues who are present here today in this important event and sharing our common cause. All of us, together, by working and aligning our policy with practice and turning evidence into actions, we can make a lasting difference in the lives of Afghan families, most particularly to women, children, and the most vulnerable in the generations ahead. Terima kasih, Assalamu alaikum, and thank you very much.